Mosquito bites on baby's home remedy. There's nothing more heartbreaking than watching your baby cry. And an itchy, sore mosquito bite will only give them yet another reason to burst into tears. Unfortunately, your little one's skin is much more sensitive than your own. The creams and ointments you put on your own bites may cause more harm than good for your infant. Home remedies can help reduce the itchiness and discomfort of a mosquito bite. In this article, we examine home treatments that could bring quick relief. Natural home remedies for mosquito bites on babies. Your child's skin is sensitive, which is why the practice of preventing the use of chemical-based agents goes a long way towards maintaining healthy skin. Here are some simple but effective herbal remedies for mosquito bites on babies. Number 1. Baking soda. Baking soda restores pH level, and just 1 teaspoon of baking soda dissolved in 1 cup of water alone will reduce itchiness instantly. Apply it to the bites with a clean cloth and let it sit for 10 minutes before washing it away. If your baby's skin starts itching, discontinue its use. Number 2. Lemon. Lemons provide anesthetic and anti-inflammatory benefits and are the simplest and most natural cure for mosquito bites on babies. Just cut up a lemon into 2 pieces and gently rub it over the affected regions. Another alternative is to apply a few drops of freshly squeezed lemon juice on the skin. Number 3. Apple cider vinegar. A warm bath with 2 to 3 cups of apple cider vinegar added into the bathtub works wonders against multiple mosquito bites on your child's body. Just try it and see yourself. It can cause dryness, so discontinue this if you notice your baby having drier skin than usual. Number 4. Aloe Vera. Aloe vera is known to treat itching, swelling, pain and has natural antiseptic properties which makes it a good home remedy for treating mosquito bites on babies. Keep it in the fridge for around 10 to 15 minutes, then gently rubbing it over the affected areas. Number 5. Toothpaste. Toothpaste varieties that free from fluoride and sodium lauryl sulfate can be used for treating mosquito bites in babies. Just dab over the affected areas directly to eliminate itchiness and painful swellings within a brief time period. However, use this carefully as toothpaste has fluoride. Number 6. Tea bags. If you don't mind the unconventional route, then tea bags will come to save the day where mosquito bites are concerned. Tea bags contain tannins which are known as astringent agents, perfect for treating mosquito bites by draining fluids from affected spots quickly. Number 8. Honey. Did you know that honey's got an amazing shelf life? It's time to take out that stash of honey and apply a thin layer over your child's affected areas for an instant natural treatment. Honey is known to eliminate inflammation and soothe areas that are affected by mosquito bites. Number 9. Garlic. Garlic has been used as an ancient remedy for treating swelling and inflammation for years. It is also used for treating mosquito bites, and the way you use it is by rubbing garlic over the skin areas that were bitten by mosquitoes. Wait for several minutes and rinse the skin with water afterwards. Number 10. Sea salt. Sea salt has rich anti-inflammatory and antiseptic properties, which makes it a simple yet amazing mosquito bite remedy for baby. Just grab some from the kitchen, mix with it warm water and clean over the bitten areas to reduce swelling and inflammation. Make sure to avoid the eyes and sensitive areas. Number 11. Onion. Not only can onions bring tears to your eyes, they can bring relief to your mosquito bites. The onion's juices, which leak out from the freshly cut bulb, can reduce the bite sting and irritation. Onions also have a natural antifungal property that can reduce your risk for an infection. Cut a slice from an onion, the type doesn't matter, and apply it directly to the bite for several minutes. Rinse and wash the area well after you remove the onion. Number 12. Milk. The proteins in milk calm inflammation and reduce redness and swelling. Dab it onto the affected area with a cotton ball. And that's it. These are some simple but effective cures for treating mosquito bites in babies. Just try them out, and you'll notice a difference immediately. However, If your child shows signs of fever or has rashes after being bitten, consult a doctor if they do not subside. Prevention. Since prevention is always better than cure, take the following measures to prevent your baby from mosquito bites. Cover with mosquito nets. Spread a fine mesh mosquito net over your baby's crib and car seat. This protects your baby's skin from coming in contact with these terrible insects. Keep your baby covered. You should always keep your baby's arms and legs covered with full-sleeved clothing, especially during the monsoon. Use insect repellents. Never apply insect repellents directly onto your baby's skin. Use them on your baby's clothes instead. Mosquito repellents consist of DEET, which is unsafe for babies younger than 2 years. Keep your child away from water bodies. Accumulated water and woody areas are the ideal breeding grounds for mosquitoes. When you take your baby out for a stroll, avoid such places. Invest in window screens. Cover the windows with nets or screens. This will prevent the mosquitoes from entering your home. You can also turn on the table fan to drive the mosquitoes away. Keep the doors closed. Keeping the doors and windows closed once it turns dark can do a lot to protect your baby from mosquito bites. Pay attention to the colors. As mosquitoes tend to be attracted to dark colors like navy and black, it makes sense to clothe your infant in light-colored clothing. You should check if your baby's room has ultraviolet, blue or fluorescent bulbs and replace them.